Welcome to the Union Labor Advisory Network podcast, where our mission is to support, educate, and promote informative content relative to the union labor community. For more information, a calendar of events, and union news and updates, you can visit our website, ulanetwork.com, and follow us on all social media platforms by searching ULA Network and/or the Union Labor Advisory Network. And now, on to the show.
Hello, friends, and welcome to the Union Labor Advisory Network. I'm Mike Fina. Today, I'm proud and privileged to have Megan Hill, PT, DPT from Sword Health join us today on the network to learn a little bit more about her background, history, and experience, and what Sword Health is all about. So, Megan, thank you very much for joining the show, and love to learn a little bit more about you and your experience and how you got into labor.
Awesome. Thank you so much for having me. I am a PT DPT, which basically means I'm a licensed physical therapist, and my degree is a doctor of physical therapy degree. So I went to a lot of school to help people move better. I've been working in Sword for about 3.5 years. Before that, I grew up on the south side of Chicago, where I actually was a member of SEIU Local 73 in high school when I was lifeguarding at the beach there. Went to college, kind of wasn't sure what to do with my life, and then realized I really liked helping people be able to move better and do all the things that they wanted to do. So decided to go to PT school, learn how to help people do things like show up to work or get on the floor with their kids or run marathons or whatever they want their body to be able to do. And then after PT school, I worked at brick and mortar clinics, helping people with pain. But sometimes I felt a little bit constrained by that. Like I could only work with people who had the time to show up at my clinic. I didn't want to work at like 10 p.m. So I wasn't there. So they had to come in the middle of the workday. They had to take a time off work. They had to have transportation and childcare and money for a copay. And so I felt like I was only helping a certain subset of the population. And so discovered Sword and joined them about 3.5 years ago. And now at Sword, I work with members going through our program and then also help people understand what Sword is and how we can help at a more of a population level.
Yeah. So Megan, could you maybe go into a little bit of an overview of actually what Sword is? I know you joined in April of 2020, and just really get an understanding of this digital physical therapy world and how it's really revolutionizing or creating some efficiencies in today's labor space. I think it's really exciting, and glad that you guys are at the forefront of it and providing a lot of different services to union organizations. So it's great to hear.
Yeah, thanks for that. Sword is a company that we predict, prevent, and treat pain. We do several different things and we have a few products, but our core product is really digital physical therapy. So in our digital physical therapy program, we actually pair everybody with a physical therapist, so a human like me, and then our technology that we call our digital therapist to bring them through physical therapy programs from the comfort of their own home, whenever works best for them. So you never have to go anywhere in person. You'll be able to do your entire program remotely, and we'll help support you through that so that if your knee's hurting and maybe you're not able to go upstairs at work, we can help you sort that out on your own personal time.
That's great, Megan. And just learning about some of the building trades and people on their job sites and not being able to physically get to these particular, appointments. And then it just draws more and more, issues on their body and physical, pain, which then it, just gets accentuated. Just being able to have these particular services are great. Can you go into maybe a few key differentiators of Sword Health and what it is that you're providing?
Yeah, for sure. So when you enroll in Sword, we provide 3 things to help you with your program. First, you're going to get a human, then you're going to get some technology, and then you're going to get a program that's really tailored to you. So we use doctors of physical therapy, so physical therapists who have been trained to work with musculoskeletal conditions like joint pain, back pain, that type of thing. And they guide you through your entire program. So one of the things that's really cool about Sword is we're actually an international company. So we have clients and members around the world. But when you're in the program, you're going to work with a physical therapist who's local to you. So you live in New York, you'd work with somebody who's in the US, who has a New York license, who knows what it's like to be a New Yorker going about your day, and they'll guide you through your program. But, there's a lot of people in labor in Canada. And if you were in Canada, if you lived in Toronto, you would work with a physio who is actually living in Canada, licensed in Ontario, and knew, what football is in Canada versus in the United States. So that human's going to be the one really giving you that support throughout the entire journey. So if you have questions, concerns, if you don't know what to do next, they're going to be there for you the entire time to help you go through your program. We also have this technology that I called earlier the digital therapist. So this is a tablet that guides you through your exercise program. So when you meet your PT, they're going to design a program for you. They'll come up with the exercises that'll help you. And then every time you do a session, you'll use the technology to get feedback about how you're moving. So you're doing the exercises correctly and you're getting the most out of them. And then your physical therapist will be able to see the results of everything so that they can tailor your program. So it's like having somebody in the room with you, but you don't have to schedule with another person. You can do it whenever works best for you. And so that might be like in the middle of the night or on the weekend or at lunch, whenever you have a few minutes to get moving, but you still get that feedback you would have by having a person with you. And like maybe you're not somebody who's super tech savvy, you have a flip phone, like that's okay. We'll send you a tablet. We send you all the equipment you need. And we even send a Wi-Fi hotspot. So if you don't have Wi-Fi at home, we'll take care of that too. So we want to make sure it's really accessible to everyone, whether you're somebody who has like the newest iPhone the day it comes out, or somebody who's like, you can call my house phone. We'll make it work for you.
That's great, Megan. And I know there was some questions, again, just understanding a little bit more about Sword Health and some of the digital physical therapy. Those tablets, nobody's seen you on the other end, right? So like, you're not doing this in the house and like you have a physical therapist or some computer like watching you do it from home, right? Doesn't work that way, right?
Yeah, great question. So no, we can see your movements. We capture that with motion capture technology, which basically means you put sensors on your body that track how you move, or the tablet's camera will track how you move, but we don't record anything. So you can be in your PJs. It's totally fine. There's nothing taking any video or audio, but it basically is like being in Tron. You have a little outline on your body. And as you move, if I move my arm out and I bend my elbow, it'll say like, Megan, don't bend your elbow. So I'll learn how to do that movement correctly and be able to do that movement safely. Like when I worked in clinics before coming to Sword, I would send people home with little stick drawings that I made or printouts, and they would go home and they would try to figure out what I was trying to make them do. And then they would come back and be like, I have no idea what you're talking about. I just didn't do it. I thought I was doing it wrong. It hurt. I wasn't sure. And it was like, they didn't do anything between our visits. And if I'm only seeing somebody once a week, that's really not enough. So this lets people get that feedback really quickly. So in the moment, and then I get to look at their results and say like, oh, Mike, that was a disaster. Like you cannot figure out how to squat. No big deal. Like let's change this and make this exercise different next time so that you're not struggling through something that is frustrating or feels terrible. We can make this better next time. And so your program's always going to be the right level for you and the right challenge and the right exercises, no matter kind of where you are in your pain journey.
That's incredible. And you see, all that data that gets downloaded right to the physical therapist so they could see all those movements, I guess the progression of how you're feeling or the motions and if you're hitting those particular target goals. Again, my wife had the pleasure of, I guess unfortunate pleasure to be able to utilize the service with some tendonitis in her hip. And again, I know she's a fan and it was something that actually helped her very much. And she's back in recovery and walking fine right now. So I know she's a test case and a big advocate too. So it's great to see it does work and the systems are all, just getting revolutionized and upgraded on a regular basis too. So it's really cool.
The ULA Network would like to thank our sponsor, Sword Health, for their support in helping to educate and promote union labor and our communities.
So there's really no risk in regards to like stepping in to utilize, virtual physical therapy as an alternative solution to existing physical therapy. It's not something to replace maybe, but to offer as an alternative solution for people that can't get to these brick and mortar facilities.
Yeah, like if we look at how many people in the US need physical therapy in a given year, only something like 1 in 10 people actually step foot in the door. And then only something where between 3 and 5 out of 10 people complete their plan of care. So we know that PT works when you can actually do it, but it's really hard for people to get there. So we're hoping to remove some of that burden and create like another option for people so that they can get good care. They have an option that's not surgery, that's not opioids, that's not going to the emergency room in the middle of the night, that's not calling in sick to work, something that can help them get better and that's affordable and easy to use. And then for the member, what's really nice too is there's no cost share. So the member doesn't have to have money in their pocket to engage. We're really saving money overall and making it easier for them to engage.
Wow, man, that's incredible. And again, thank you for that overview and review. And with the future of SWORD, what's the next steps, or what's going on, or is there any upcoming releases or things that are going on with SWORD that you might want to let the ULA Network viewers know about for today?
Yeah, there's actually a couple really cool things we're doing, but one I want to mention is called Bloom. So we have Bloom. It's a women's pelvic health program. 1 in 4 women suffer from pelvic floor dysfunction. So this could be things like pelvic pain or incontinence. And this can happen with something like having a baby, but it also can just happen randomly. And those are the things that are really hard to talk about. They're often very embarrassing. They can cause you to miss work because you can't go to the bathroom every 10 minutes when you're at work. So you might have to stay home if you're having these symptoms. So we have a pelvic health program where you work with a doctor of physical therapy who has pelvic health expertise. You get best in class technology to guide you through an exercise program, and you still get that tailored member experience, but it's really focused on this more like specific issue. And so I love this. It's probably one of the most exciting things to me personally that we've done at SWORD, but it's just kind of one of the many things we've rolled out in the last couple of years and are rolling out in the future to help support people in addressing the overall problem of pain.
Now, if somebody or a union was interested in learning more, where do they go? How do they get in touch with somebody to learn more about your services and how it may integrate with some of the insurance policies or programs that they have today?
Yeah, well, we would love to hear from anyone who's interested. It's also really cool to see live. And so we do demos, and we can also let you test out the technology to make a decision as well. So you can reach out to us on our website, which is swordhealth.com. And we can also get you all the information you need and in touch with the right person there.
Perfect. Megan, I want to thank you for your review, your background, everything that SWORD's doing as well to enhance the lives of so many people, especially in the trades and different public sector organizations where they're using their body every day. And when there's pain, obviously that incurs, cost, time, and people out of work. So, just providing these services to help people's lives and just keep running, keep America moving is really important. And I'm proud to have you as a sponsor, supporter, and great to see all these efficiencies that are coming up within the labor space to drive value and just better benefits for the membership. So again, thank you so much for your time, Megan. Appreciate all your support. And I'm sure we'll have you on again to talk a little bit more about some of the services and some of those demo journeys or maybe new technology that you're having down the line. So again, thanks for everything.
Well, thank you so much. And hopefully you don't ever need me, but should you have any problems, just reach out.
I know how to get you. I think you're on LinkedIn as well, so we'll find you. Again, appreciate your time, and we'll talk soon. Take care.
Thank you.
I'd like to thank all our sponsors for helping to build and promote the ULA Network. It is because of you that we're able to support, educate, and promote informative content relevant to labor. Please subscribe, like, and share our channel and media. I'd like to thank you all for your support.